So I'm Dr. Luciana da Costa. I am a veterinarian on the College of Veterinary Department of Preventive Medicine at the College of Vet Med here in OSU. I've been working with dairy since I was graduated, so kind of like 30 years. And most of the time I did my work on cows just because we have more cows, but I have a lot of passion for small ruminants as well. My master's was in small ruminant, and now I am associate professor, and I do have an extension appointment as well, working with milk quality, mastitis, dairy herd management. So everything that I guess involve dairy, it is like it's fair game to be asking me. Thank you very much, Pressley, Brady, for putting this together. I think it was an awesome idea and needed. And I'm very, very like pleasant to be. It's a very pleasant invitation, and I'm very glad to be here talking something that I really like it. So we were just talking, and if I talk too much, you guys just have to like stop me, because it's something that I've been working for so long that I'm really I love this topic. So today I was invited to talk a little bit about udder health and milk quality, and okay. In goats, right? So the goat industry is a well-established industry in countries such as France, Spain, Italy, Greece. But here in US, it's a growing sector. So we have a lot of this small scale, or I call it backyard farms, that we do not know how many do we have, but it is a reality. So we, at the same time that we have a very well-established farms, we do have those small scale and backyard farms that sometimes it is difficult to have an information getting to them. So I've like, feel free if you have any questions, and you can stop. It will be a very informal talk. And like with the small scale and backyard farms and those large scale farms, what we've been seeing is, as in cows, consolidation or intensification of the technology. And sometimes this does not go hand to hand with facilities, for example. So you will be using a facility that you already have. So it's probably not the one that you want, for example, but it is what you have. And a lot of the training for good milking practices, or even simple things as an appropriate handling, sometimes are missing from our farms. And all of these will be causing diseases. In our case today, we will be mastitis, right? So what is mastitis? You probably might be hearing me saying inflammation of the mammary gland, as definition of mastitis is, but also it is called an intramammary infection, or shortly we can say IMI, right? So mastitis is really a very prevalent disease, and it is because it is a multifactorial disease. So this will be a word that I want you guys to remember, right? Like, it's a multifactorial disease, which means that we have a lot of factors that could be playing a role on causing this disease. And most of the times it will be caused by bacteria. So there's a sequence of events that you will be culminating on that disease. The first one will have to have the bacteria. You have to have the presence, and that bacteria has to enter the inside to the gland. Then that bacteria needs to be multiplying on those tissues where milk is produced. They will be releasing toxins, and then some immunological events will be happening in a tentative to destroy that invading organism. So here, for example, those blue dots that you are seeing here are the bacteria, okay? Bacteria are everywhere. Even if you have a very pristine place, you will have bacteria, right? In our hands, we do have bacteria. So the teeth skin can be colonized by bacteria. The difference is that that bacteria has to go inside the gland. And by getting inside the gland, again, she will be leading to the interior of the gland, where she will be multiplying. And when she's multiplying, she will be getting and releasing those toxins and killing those cells that are producing milk, the tissue that is producing milk. At the same time, the body will say, well, I need help here because it's something that it's not supposed to be happening. So white blood cells will come from the blood into the interior of those cells, and it will be killing those bacteria. So to the sum of this, the debris of those tissues that it's dead now, the bacteria and this white blood cells, the sum of all of these is what we call somatic cell. So somatic cell is an indication of mastitis, right? And more bacteria you have, more strong immune reaction do you have, the greater will be your number of somatic cell. So this will be, mastitis is a very costly disease. And I have this slide very heavy because there is for a reason, because there's a lot of costs involved with mastitis. So the first thing that comes to our mind will be a lowering milk in production. So we will have a lower volume of milk being produced, and the cheese yields will also be affected because we will have a lower level of components. And if you are feeding that animal the same thing that you were feeding before, and she is producing less milk, the feed costs, it will be higher, right? So you will be losing sometimes like the bonus for those high quality milk. If you are not producing a high quality milk, and you can be penalized, and sometimes if your quality is low, you can also receive some letters saying that you are not invited to send your milk to us anymore. Then can be rejected. And then you have to decide what you're going to be doing with that situation, right? So that animal that it's being infected, you will have to have those animals or to be replaced. In this, you will be losing the marketability of that animal. So instead of selling that animal, you have to replace. So you have to pull one animal and replace with another animal. So we will be losing the potential of being marketing that animal. And also, if that animal is dead, you have to deal with all the management that involves that. And the management is not just the management of one animal being dead, is the management of the time as well. So we will have to, instead of doing something else, you will have to managing treatment. You will be dealing with drugs, we will be dealing with labor, you will be dealing with lab investigation. And we will be talking about this, but lab investigation is something crucial, very important when we are talking about mastitis. The vets will be coming, so we will have the costs involved with this as well. If you are treating those animals, we will have to discard that the milk from those treated animals. So all of these, like it's cost associated with mastitis. And you have to keep track of which animals you are treating, how many times you are treating those animals. So there is a lot of things that it's not just like, oh, I have mastitis and then my animals will be producing less or will be sick, right? You have to segregate. So for example, from those contagious pathogens, you will have to, one of the ways that we manage, if we are not cooling those animals, it will be to segregate those goats, and then you will have like a cost on your time for doing this as well. So it is a lot of implications on having a case of mastitis in your herd. And so there is an animal cost and a public health cost as well, because a lot of those, not a lot, but a couple of those pathogens that can be causing mastitis can also be zoonotic, which means that it can be passing from the animal to humans. And we are talking about food, right? We are talking about milk. So it's very important in terms of like a raw milk market is to have a very good quality milk. So how our ladies get sick with mastitis on this case? So I told you guys, like the one thing that first now we have to remember is that the multifactorial disease. And those are some of the factors that can be contributing on causing mastitis. There is factors to the animal, factors to the environment, and factors related to people as well. So just to give an idea, those are some of the factors, not all of the factors, but some of the factors that we have to be paying attention. So for example, milking machine, right? People, how do we handle those animals? Those bacteria, which bacteria we are dealing with? Is no pathogenic bacteria or pathogenic bacteria? Stress. Stress is something that is being studied more and more now, because we are seeing a lot of the effects on stress and causing diseases. In traumas, lesions, infections agents such as CAE, for example. But the most common for us, like to keep it simple from today, we will be talking about mastitis related to bacteria, okay? Multifactorial disease, and now remember that animation that I told you guys, that those bacteria are on the teat skin and they have to get into the gland. So someone will say, well, the teat skin, the teat end, it will be the first line of defense for the teat canal, right? And it's right. So this is the first line of defense that we have to avoid those bacteria to get into the gland. And just because we have like some physical and chemical barriers, such as this, for example, the keratin plug, that it will be, it's kind of like a wax that it will be forming between the milking, and it will be closing the teat end. So I'm trying to diminish the probability of those bacteria to get into the gland. And also we have some structures from the gland, such as the sphincter muscles, that it will be closing. Again, just try to decrease the probability of those bacteria to get into the gland. So the main door for bacteria to access the interior of the mammary gland is through the teat and the teat canal. So with that, we should be able to, from this picture here, have an idea how important it is, for example, when we are using some dipping, right? So those are the things that if you imagine, looking at, these are cows, but it's the same idea for goats as well. The amount of bacteria that it will be hiding here compared to this healthy teat. How much easy it is to clean something like this healthy teat compared to this, right? So if you have something like this, cracked and very dry, this is a risk factor for mastitis. And you have to find out why you are having this type of teat. If it's your, could be your milking machine, could be your your dipping, that it's not with emollient enough, or so anything, it could be causing this. And the development of mastitis is proportional to the number of bacteria growing on the teat end. So again, we have to remember that animation, if you have a lot of those blue dots here, like a yellow dots, more dots you have, more bacteria you have, higher is the the chances of having mastitis. Okay. How I identify the problem that I have. So you are milking dairy goats, you are looking at the appearance of that milk. It's that simple. So the animals will come and you will be stripping and looking at the milk appearance. If you have something like this with flakes and clots, or if it is more watery, or there's some different colors, could be blood, this is a problem, right? So you have to first identify those problems. So this is easy, right? When you see something like this, you see the problem. But then sometimes it's not that easy. Then you have a goat side test, which will be like California mastitis test, that can help you because it will give you an estimation of the somatic cell count. So remember that somatic cell count is an indication of mastitis. And by doing this test, you will be able to see if you have or not have an increase on somatic cell count. This CMT is a very easy and not expensive at all to be done. So we should be using, and I hope you guys are using more this test. There is some limitations, but it is a very good test in terms of identifying those early onsets of animals. And then you can classify mastitis. You probably hear about like clinical mastitis and subclinical mastitis. And clinical mastitis is what we saw on here. So you have a problem with the milk, right? And it's very easy to see. So it's a clinical problem. But and clinical problem could be like you don't have anything yesterday and you have today, or it could be happening, quite sometimes, and sometimes I see, sometimes I don't see it. And it can be mild, moderate, or severe. And we will be talking a little bit more about that. But the problem is when you see one case of clinical mastitis, it's pretty sure that you have much more cases of subclinical mastitis. And this being under the radar. And this is the cause that you have lower production, or you will be losing a lot of money because of those subclinical cases. How do I identify those subclinical cases? Based on the somatic cell or the linear score, which is just like a log transformation for the number of somatic cell count. There's a formula that you have to use, but both of them is just an estimation of the number of inflammation that you have. And then through CMT and DHIA. If you are on DHIA, you'll probably be receiving those reports. Please look at those reports, and if you do not know how to read them, look for someone who can teach you how to read those reports, because it is very important to identify those high somatic cell animals. And if you are not in DHIA, do CMT. You will be just like, you will get the same information in terms of a high somatic cell for those. So clinical mastitis, again, you can have mild, moderate, or severe. Mild it will be just like having some, the milk is unusual. There's something on the milk. So it could be flakes, it could be clots, it could be blood, more watery. So it's not normal, right? Mild, it's just the milk. Moderate, you have the milk that is off, but you also have the udder that is start to be swollen or hot or sensitive. Sometimes you will be touching, she will be kicking. So we will see that there's something here. And then those severe cases. On those severe cases, not only the milk is abnormal, the udder is abnormal, the animal is abnormal, right? So she will be off feed, she will have fever, she will have depression. So this is the case that you have to pay attention and to act quickly. Otherwise, you can be losing those animals. And hopefully you guys have not seen much of these, but there's like those blue bags, sometimes it calls, it's visible clinical signs of this discoloration. It could be more like purple, bluish, very painful. And this progress very fast and can be going to the death, can be leading to the death of the animal. And sometimes you will have things like this, that it's like a gangrene, that it will be falling the skin. So it's not pleasant to see it. And gladly is not that many cases that we have like this, but 8 to 10% of those clinical cases can be something like this. Most of the cases is Staph aureus, and I will tell you guys now, like we will be talking a little bit about some of these pathogens, but Staphylococcus aureus will probably, like it's a Superman bacteria. And if you ask me if you want to choose one bacteria to be, which bacteria you want to be, I said, I want to be Staph aureus, because it is a pretty, like it's very strong, it's very smart bacteria, and will be causing a lot of damage. And he can protect himself really well. So treatment, it's not very effective. He will be hiding from you. He will be spreading very easily. So we have to be careful with Staph aureus. Huh? And when you have something like those animals that are dead, there's also a risk for flies. And we do not talk much about flies as a way to be spreading that disease. Like in cows, we talk a lot about being the heifers being contaminated by flies and having mastitis. The role for flies in small ruminants, we do not have a lot of research as we do have in cows, but flies are flies, and bacteria are bacteria. I pretty sure that we have to pay much more attention on flies in small ruminants as we talk in cows as well. So make sure that you have your areas as the milking parlor, the pens, with somehow a fly control. Okay, because this could be something that important that could be playing a role. And one other thing that I will say now is that one word, multifactorial, and the second word that I use with my students is mastitis is a detail disease. Okay, so every detail, especially because it is multifactorial, you have to pay attention to a lot of things. It's also a lot of things with careful. So a lot of things in detail. This will be dictating the success or not in the prevalence of mastitis. And then we have the subclinical mastitis. The subclinical mastitis is those animals do not show any signs in the mammary gland, in the milk, sometimes not in the mammary gland, but they will be in your herd. And since they are very quiet, they can be, depending on the pathogens that you have, they can be passing from one animal to another animal. And the way that the bacteria, for example, Staph aureus doesn't want to kill your animal, right? Because if you kill your animal, he will be dead as well. So what he wants is to be spreading from one animal to another animal and to be there. And that way you have a subclinical mastitis, lower production, but you also will have a chronic mastitis because it will be there, quiet, nobody sees. If you're not paying attention to your somatic cell, either DHIA, CMT, you're not going to be detecting those cases. In your production, it will be lower. So that is the cost of those subclinical mastitis. You will have a lower production in a lot of animals, because those, the subclinical mastitis, the characteristics of the subclinical mastitis is to become chronic. So we talk a little bit about clinical, subclinical mastitis, and I mentioned some names of bacteria here. And we can start it with another classification for mastitis. So clinical, subclinical, and sometimes you will be hearing contagious mastitis or environmental mastitis. On contagious mastitis, the main reservoir for that bacteria will be the mammary gland of those infected animals. And the most common contagious pathogens, the classical one, is Staph aureus, okay? Again, it will be subclinical form, and then you will have a lot of chronic animals because it's there quiet, passing from one animal to another animal as he is a contagious pathogen. So if it is contagious, and it will be passing from one to another animal, we have to pay attention to a special time that is our milking time. And the detail that we involve this, like I have 4 classes that I give to my students just on contagious pathogens, controlling, troubleshooting contagious pathogens. Such a detail you have to be like looking at everything. So here we don't have 4 hours, but it's very important that we keep in mind contagious pathogens inside the parlor. And inside the parlor, everything that it's, since the animals, the does will be entering the parlor until they leave the parlor, everything is a risk factor for mastitis. The way that they're getting in, if they are stressed, so the handling, it starts from there. The stress can be causing some risk factor for mastitis. And once these animals are there, we will be, and we talk a little bit more about this in a couple of slides, but I think repetition is good for us to be like discussing something of this later. But the milking machine is very important. So all the regulations of the milking machines is important. What type of material, what type of slipper you're using, or the units and everything. Cloths, what type of towel are you using it? It's wet towel, it's dry towel. How many towels do you have to use? Should I use? And it's always like when some people will ask me, how many towels should I use? Is just one towel enough? I will say, well, what is the answer for that? Like, what is the classical answer that we always give? Is depends, right? So depends, depending on if it's too dirty, probably more than one. If it is clean, one will be enough. If it is a positive animal, should I be using the same cloth from one teat to another teat? Probably not, because I will be passing from one to another. So all of these are details that we have to be paying attention when we are talking about contagious pathogens. And then environmental pathogens. On the other hand, contagious, we have to look at the infected mammary gland for those infected animals. Environmental pathogens, as the name implies, we have the main reservoir here, it will be the environment. So bedding, housing, water, soil, all of these, it will be very important when we are dealing with environmental pathogens. And an example of those are coliforms, right? So E. coli, Klebsiella are the most common ones. Well, it will be easy if we have just like contagious and environmental pathogens. But since nothing is easy, we do have some that it's called miscellaneous pathogens. And in our case here for goats, the most prevalent organism is those that we have in a category of miscellaneous pathogens, because they can be behaving as a contagious or they can be behaving as an environmental pathogen. And those are a very big group, 30, 50 bacteria in one group called coag-negative staph, Before it was coag negative staph, so probably the old people will be remembered as CNS, and the new people will be remembering, will be non-aureus staph. Okay? And by far, this is the most prevalent organism that we have in goats. When I receive some calls or someone will be asking me to, could you take a look and try to help me? Usually the problems leading to a herd investigation will be high somatic cell count. Okay, they will be doing like a bulk tank, and it will be exceeding the limit. And sometimes the limit that we have on a PMO is not the limit that we have on the market. So some cases I will have someone calling me saying, I have my bulk tank is higher for 100 or 600. So it all depends again. And sometimes if you have a herd that is 400 and have 1-2 tests that it's increasing, and by 500, 600, they will already be calling me and said, I have a problem because my somatic cell is around 400 and now I have 600. Or so it's, each farm is different. Or you have a sudden or a gradual increase on those somatic cells, or you have some cases, clinical cases or chronic cases. It's all the same. And it's being like, I have some persistent high somatic cell dose and I do not know what to do. We tried this, we tried that, we tried treatment, we culture it, there's nothing. So most of the times it's around, those are kind of like the questions that I've been called to resolve, right? To help. And then now what? Like sometimes you are stuck because you have done everything, and so then I go back to the basic. Okay, basic, it is very important. So we talk a little bit about the milking procedures, the environment, and knowing your enemy. And again, like when you are like starting from the beginning, basic, it is the important thing. Let's go back and take a look at milking procedures. Let's go and see your environment, how clean it is, how comfort it is, how's your water, test your water. Like there is a lot of, so it's not just like those 3-4 words that it's in here. So cleanliness, for example, it's very easy to see how clean. Maintain your bedding dry and clean, right? Sometimes it's very difficult to maintain your bedding dry and clean. But if we know that that is a risk factor and you are dealing with an environment, a pathogen, you have somehow to fix that problem. And to know this, you have to know who your enemy is, right? And this is just by doing some culture. So culturing those milk, it's very important for us to be tailoring our control and how we're going to be treating or controlling or preventing those cases. So let's try to revise a little bit about the milking preparation and the main points that we have, like hygiene of teats and udders. So this is crucial, right? If you have to clip those long hair, do it. If you want to wear gloves, do it. If you do not like to wear gloves, you have to wash and sanitize your hands before starting it. There is a very cool study that shows the number of bacteria that is on your bare hand in hand with gloves, clean and dirty. So clean gloves is better than clean bare hands. And dirty gloves is better than dirty hands. And my point, like it's always, if you can keep clean hands, you probably should be using gloves, right? Because if it's clean gloves better than clean hands, why not, right? it's one of the very few risk factors that it's always significant in terms of statistical significance, is always significant wearing gloves and decreasing the prevalence and number of mastitis. So why not? Stripping for milking and then sample into teat cup to examine that abnormal milk. So like one of the first slides that we showed, it was exactly showing that. Do a CMT and see if you have any abnormality on your teat, on your milk, on your udder. If you think that you have a problem, do a CMT. Follow your intuition. Like if you, I think it is, do it. Do not wait, because sometimes if you wait, it might be too long, too late. How do we clean those teats and udder? So we start from the teat and then we go up to the udder. So it's not the opposite. So we do not start cleaning the udder and going down to the teats, because then you are just bringing all the debris, all the things that is dirty to the teat end, right? So we talk about like teat end being the entry of bacteria. So cleaning from the teat end to up to udder, and using single paper towels, or if you're going to be using towels, cloths or paper or towels, make sure that they will be washed with bleach and dry, because bacteria can survive in a cold wash. So it needs to be washed with hot water. And there is some farms that I have that they will be using some wet towel, just because it is easy to clean. If you do a culture on that wet towel, you will find more bacteria than if you do a culture on a dry towel. So it's very dangerous to be using those wet towels, right? And make sure that the udder is dry before you apply those teat cups, and use the pre-dip. It needs to be approved. And I sometimes, like, you feel that I don't have to say that it's an approved product to be used, first because we are talking about food, but sometimes you especially, and I understand you are just trying to lower your cost by using another product, and sometimes that product first is not approved and first is not effective. So instead of being helping, just because you are doing pre-dip, it doesn't mean that you are doing an effective pre-dipping. So pay attention to those products. And sometimes even those approved products, they will be targeting more one specific pathogens compared to another one. So sometimes we do have to change those pre-dip if you have problems with mastitis. Again, the detail is very important. We have to remember, like, anatomy for goats compared to cows and ewes, for example. The majority of the milk in goat, 80%, almost 80%, it is on the cistern. So it's not in the alveoli as in cows. So cows is the opposite, right? So majority it is on the alveoli. So milk let down, it's very important. In goats, 80% is exactly the opposite. Almost 80% is on the cistern, which means that you don't have to be you have to be careful when you're doing your stimulation to have that milk let down, but you don't have to be as careful as it in cows. So milk units can be like in 1 minute, 2 minutes max. You can just attach those milk units, because you will be having that cisternal milk being harvested. If you have, as in this case, like just one gland that will be milked, make sure that you have a new teat cup that it's plugged here, to avoid, like, do not attach to the other, because over milking, it is another risk factor for mastitis. When you over milk, like peak milk is usually 30 seconds after you attach that unit. And again, like remember that it is the milk is on the gland cistern, and it will be completed in 1 minute to 3 minutes, depending on the production level that you have. And if you over milk, it will be leading to a teeth end damage. Coming back again, like teeth end, it's a very important structure for us on related to mastitis. Vacuum, those milking equipment, we do have to maintain those equipment, like call someone to be doing those maintenance, because vacuum, it's really important. If you have an automatic take off, make sure that, like when they are detached, the way it will be away from the dirt, because sometimes they can be just sucking all the dirt and all the not good things inside, and it can be contaminated. It can be like decreasing your milk quality. And then again, like when you finish everything, you will have to replace that milk that it's good for us. It is good for bacteria as well. So if you leave that milk film on the teeth, they will be just a nutritious media for bacteria. So we have to replace with the post-milking. Again, like the products that you're going to be using, it needs to be approved and it needs to be efficient. And you have to make sure that you are doing that in a full coverage. You're doing that properly. So for example, on this, we are covering half of the teeth, but the other half is not. So this is a little bit better, but it could be a little bit more covering the whole teeth. Okay. One of the things that we have to be careful when we are using those deep containers is that most of the times, if you are using a product, for example, iodine, they will be decreasing the effectiveness when you are full of organic material. So changing that, so if it's not that clean, and if the teeth is not that clean, if you have a lot of material or defecate inside or something, like it's not a huge problem on goats, as the type of feces is different from cows, but it's still like sometimes a lot of organic material can be decreasing the efficacy of those products. Ensure that the coverage of the teeth is adequate, and at least is standing for 30 minutes. So you will have that sphincter, those muscles closing in, again, just avoiding those bacteria to get into the gland. If you already have the problem and sometimes, like for example, if you have a staph aureus problem in your farm, sometimes depending on the number of animals that you have, like the percentage of animals that you have, you can be cooling those animals, but sometimes if you have a lot of animals, you have to manage those animals in a different way. So one of the things is the order is very important, right? Like the milking line is very important. So we'll have first those Olings first, then have a healthy multiparous, and then last will be those contagious pathogens, or the last will be those mastitis, hospital, those will be the last. Make sure that you identify those animals, right? Because if you are the only person doing this, then you probably know your by name, but sometimes in a little bit more large operation, sometimes you have helpers and but like probably your helper doesn't know. So using lag band is a very efficient way of identifying those animals. You can be using marker or paint, but there's a problem because sometimes they can be disappearing before the withdrawal period is complete, or can be persistent too long, right? So Maybe it doesn't need to be there, and it's just because the marker is there, you assume that is the animal that needs to be or diverted, or like, so identifying properly those animals are very important. And again, if you have someone helping you, the communication is crucial. Okay, having like a board or any type of communication, effective communication, it will be useful. So just on pictures now, the control, you have pre-dipping, clean others, and then pay attention to your milking machine. It could be simple, right? It doesn't have to be, but it needs to be maintained properly. And then full coverage of dipping to avoid that. So here we have the CMT being done, and very easy test to do, quick, and it will be just having some milk, and then we will be mixing with the reagent, same quantity. And sometimes what I heard is, what I have difficulty in is just to how much it is that I have to use. Or so you see, like, it's not that much milk, and sometimes how I have difficulties on having the same amount of the reagent. Is that important? If you have, like, you see, like you are doing by eye, like you are, it's a so it's exactly what he's saying now. Like I thought I have no sound, but now you can see already, like, the formation of the gel, which means it will be positive. Okay, so let's see here. How can I mute it? Whoops, I do not know how I muted this, but okay. And then when you have something like that, if you already have that gel formation, it means that you have something. What it is, I do not know. By looking, I do not know. So I have to have some samples sent to the lab, and then they will be culturing, and then I will have the results. But one thing that is important, it is how to collect milk samples, right? Those milk samples need to be reflective what it's inside the mammary gland. Because if you are not taking those, you're not using gloves, you're not cleaning, this could be what I have on the skin, for example. And sometimes what I have in the skin is not the same thing that it's causing the mastitis problem. So all of these is very important to take note. Questions that I got all the time is, what happens if I only do CMT? So which one is better, CMT or milk culture? Well, again, depends, right? Depends, because CMT will be good for you to know if you have or not having the problem. But the culture, it will let you know what type of problem are you having it. But again, if you collect good samples, you have that answer. If you collect bad samples, you will have bad plates, you will bad results. Results like this doesn't help me in anything. This will be calling contaminated. So I just spend a lot of tests, because we have to do a lot of tests, and my results will be contaminated. Cannot do anything with those results. So one of the objectives of this study was to describe the relationship between pathogen, somatic cell, and CMT, right? This was a study that we conducted in a commercial farm with 80 milking does, and milk samples were collected following those guidelines we did CMT in somatic cell and milk components. And like very briefly here is just to show you guys that we have negative and we have positive, right? But those negative, and here I have the somatic cell count. Were you expecting to have those negative culture being high in somatic cell? Or you will be just looking at those positive? I will be expecting just those positives to be high in somatic cell. One of the things that we have to pay attention when we have a negative results on culture is that sometimes it's not reflecting what we have in the mammary gland. And again, like this could be for there's different factors that can be playing how to explain this. So one will be dilution, right? I will be just getting a sample of that milk, and that goes to the lab, and I will have a very little sample from that tube plated on my media to see if they will be growing and what is going to be growing it. So sometimes it's just a matter of dilution. Sometimes it's like Staph aureus. They will be shedding in intermediate. So sometimes they will be shedding, sometimes they do not. It is there. It is causing somatic cell to get higher, but it's not going to be showing on my culture. So a lot of those results, or no growth or negative, it can be frustrating, right? But we just have like to repeat it again and being an open mind, what can be happening in here. I told you guys that most of them, the most common pathogens is the Staphylococcus, and we have the Staph aureus here, but we have a lot of the other, this is not Staph, but a lot of this non-Staph aureus here. So it's a big group and very prevalent. And I want to show you guys this just to emphasize the no growth. So here the organisms no growth, and we have 171 samples. So it's not a huge sample, but it's a decent number. We have a lot of these as no growth, and a lot of different, you see like a different names that we will be showing in our culture. And sometimes it's just overwhelming, the names and the number of names, the different names that we will be coming from one culture to be dealing with. But all of these, like Capricorn, all of these here, they are the non-aureus staph, okay? And non-aureus staph or CNS. And those where we were able to speciate, and those we are not able to speciate on the lab. But what I want to pay attention here is, even if you have no growth, look at the range for somatic cell and look at the CMT results, right? So even if there is no growth here, I have a lot of them, like, and have CMT2, usually we look at one as a positive already, but as I said, I will be a little bit more flexible here, and I will have 32% of the no growth were positive on CMT, and the range from somatic cell is huge, right? Some of this, and that is it's very difficult to, and sometimes like challenging to be troubleshooting mastitis. When you have, for example, Staph aureus, it's a very small sample size, but 100% reacted really well on CMT, and you do have the somatic cell really high, right? So it is consistent here. And this is another farm that, again, like somatic cell, Staph aureus was consistent with CMT being high, in huge variation for no growth or no Staph aureus. Second question then that I got when you have the results is, now that I have this coag negative staph, in this case here, that the question was, what is the long-term cure rate when I treat those with antibiotics during lactation? Again, the answer, this is my answer to him, right? Like, so this was an email that I received, and then I was answering him, and my answer was like, the short answer to your question is depends, but we do not know much yet. And that is the reality. Like I told you guys that this CNS or non-aureus staph is a large group of bacteria. And if we put a lot of people in the same room, even if we all here have an interest on goats, each one of us will be different. It will be behaving differently. It's the same thing with bacteria. All of these group, one will be more attracted to the behaving as a contagious. Another one will be more behaving as an environmental pathogens. So it is very important for us to understand which bacteria I'm dealing with, and then like speciate those CNSs. And even with that, this is a new topic. So there's a lot of research being done on cows, but not as many on small ruminants. So there is like we will be learning as we're going to be dealing with this problem and studying more on small ruminants. And so it's not to say that it's very difficult and we do not have any structure in terms of how we deal with this. So for example, if you have the somatic cell and it's higher or lower than a certain number, here, for example, is 1,000. But again, like if your herd is 400, then your number will be 400. If your herd is 600, then your number will be 600. So you have to know your number. And then if it's higher than that or lower than that, then you take action. If it's lower, there is no action to be done. But if it's higher, then we will have to be culturing. And this is specifically for drying therapy, right? But sometimes you are dealing with those problems. It doesn't have to be on dry. It can be during the lactation. It's just how you're going to be, the therapy that it will be a little different. But you have to culture. You have to culture and see which your enemy. In this case, you will be culturing 1 month prior to you'll be drying off those does. And then we will see what you have. If you don't have anything, if it's clean, great. There's nothing to be done. She's good to be dry, normal, that's fine. But if you have some growth, you will have to know which growth do you have. So if it is those in it, no aureus staph, then you have to know, speciate and know which one of those big groups we are talking about. And if it is pathogenic or not. Or if you're having dealing with staph aureus or strep, again, then you have to decide it. You have that number. If it's higher than a certain number that based on in your farm, you will have to cool. If you have the opportunity of cooling, it's better, right? Because you are just like finishing the problem right there. But sometimes, like depending on the prevalence of those, if you have a herd with 30%, excuse me, 30%, 40%, sometimes it's not feasible to be, I'm so sorry. Sometimes it's not feasible to, oh, sorry, guys, to cool that animal. But if you can, then you you can treat those animals. And then you'll see at freshening, when they are freshening, how the culture is. If you culture with the same pathogen, then there's no way. Like you have to cull. But if they are freshening with no growth, then you're good to do it, to go. Something that it's again very important in terms of details is how you're going to be treating the dry treatment. So recommendations here is disinfecting the teeth ends and avoid injuries. This is the type of job that you really have to, it's kind of like a meditation, right? Like you have to take the time for doing this, because you are inserting things inside the gland, and then you're going to be drying that dough. You're not going to be taking the milk out. So everything that is in now, it's in. And if you are putting some bacteria in, that bacteria will be just, like have fun and multiply, and then we will have a problem in the future. So take the time, do some cleaning, and then the look, how the technique for infusion it's very important. If you have to call someone to show or to demonstrate how you have to do it, just do it, okay? Because this is a very crucial time. And this is crucial because in terms of treatment, there are very few to no approved, almost to no approved medications for dairy goats with little information on efficacy. And you will have to be working with your vet, because most of the times this medication is in an extra label manner, and he will have to be giving you the prescription. And so consult your veterinarian to obtain like the guidance in how it is, like the milk withdrawal, to not have problems with in your milk plant. And test the milk for antimicrobial residues, have those animals identified, so you will know that that milk from that doe cannot go to the bull tank, okay? So it's very important for those details. And prevention, right? There is a vaccine for Staph aureus and CNS. I've been hearing different responses for this. Sometimes it works well, sometimes does not work well. But again, like we have to keep in mind that the vaccine is not a solution for your problem, right? The vaccine is just one more tool that you have, that it will be helping you, like, or reducing the clinical signs or reducing the number of treatment. And it's not like to cure or to avoid to having problems. And with that, I will thank you very much for your attention. This is my contact information, and I will be glad to entertain any questions you might have. Thank you very much.